Welcome to a presentation on tuberculosis brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Tuberculosis is like a fire in your body. It starts small, but if it's not treated, it can spread and become more serious. Just like a fire needs oxygen to burn, tuberculosis needs your body's immune system to survive. If your immune system is weak, the tuberculosis can spread quickly and cause more damage. Just like a fire needs to be put out with water or other extinguishing agents, tuberculosis needs to be treated with antibiotics to stop it from spreading. Tuberculosis, TB, is a serious infection that can cause a wide range of symptoms. Common symptoms of TB include a persistent cough that lasts for more than 3 weeks and produces phlegm or blood, chest pain or discomfort, unexplained weight loss, fatigue and weakness, loss of appetite, chills and night sweats, fever and sweating, especially at night. If you experience any of these symptoms, it is important to seek medical attention right away, as TB can be very serious if left untreated. Tuberculosis, TB, is a serious infectious disease that affects people of all ages, genders, and backgrounds. It is estimated that 1/3 of the world's population has been infected with TB at some point in their lives. In the United States, TB disproportionately affects certain populations. People of color, including African Americans, Hispanics/Latinos, and Native Americans, are more likely to be diagnosed with TB than white people. In addition, foreign-born individuals are more likely to be diagnosed with TB than those born in the United States. People who are immunocompromised due to HIV infection or other conditions are also at higher risk for developing TB. People who live in crowded or unsanitary living conditions are also more likely to contract TB. It is important to note that anyone can get TB if they come into contact with someone who has it. Therefore, it is important for everyone to be aware of the signs and symptoms of this condition and take steps to prevent its spread. Tuberculosis, TB, is caused by a bacteria called Mycobacterium tuberculosis. This bacteria is spread through the air when an infected person coughs, sneezes, or talks. It can also be spread through contact with saliva or other bodily fluids from an infected person. People who have weakened immune systems are more likely to become infected with TB. This includes people who have HIV/AIDS, those taking certain medications, such as steroids, and those who have recently had an organ transplant. Treatment for tuberculosis, TB, depends on the type of TB you have. If you have latent TB, which means the bacteria is in your body but not causing any symptoms, your doctor may recommend taking antibiotics for several months to prevent the bacteria from becoming active. If you have active TB, which means the bacteria is causing symptoms, your doctor will likely prescribe antibiotics for at least 6 months. It's important to take all of your medications as prescribed and finish the entire course of treatment, even if you start feeling better. This will help ensure that all of the bacteria are killed and prevent it from coming back. Your doctor may also recommend other treatments, such as surgery or a procedure called bronchoscopy to remove infected tissue or fluid from your lungs. In some cases, they may also suggest a vaccine to help protect against TB in the future. The prognosis of tuberculosis depends on the severity of the infection and how quickly it is treated. In general, if the infection is caught early and treated properly, the prognosis is good. However, if the infection is not treated promptly or correctly, it can become more severe and lead to serious complications. In some cases, tuberculosis can be fatal if left untreated. It is important to follow your doctor's instructions for treatment and take all medications as prescribed in order to ensure a good outcome. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.